Hi, everyone. Welcome to the All Things Amyloid podcast, where we feature patients, caregivers, and clinicians who discuss amyloidosis, a rare and incurable disease. Amyloidosis occurs when the body builds up abnormal amounts of misfolded amyloid protein, which can lead to serious and life threatening outcomes. I'm your host, Mackenzie, an amyloidosis patient and founder of Mackenzie's Mission. Our goal for this podcast is to raise awareness and share firsthand what it's like to live with this disease, to care for those affected by it, and to treat it. We hope this leads to earlier diagnosis and start of treatment, which will improve patient lives. For decades, AL amyloidosis was a disease for which there were no FDA-approved therapies. Treatments we did have were often borrowed from multiple myeloma and resulted in poor outcomes for patients. It is one of the 7,000 diseases classified as a rare disease, and over 95% of those diseases have no FDA-approved drugs. In 2018, that all changed, and it created a cascade of drug approvals accompanied by a flourishing pipeline of diverse clinical trials. This has launched a world of accelerated research on amyloidosis, giving hope to countless patients. In today's episode, we'll be talking with Dan about hope and how life with amyloidosis is brighter than ever before. Welcome, Dan. It's wonderful to have you back on the podcast.
Hey, Mackenzie. I'm delighted to be back. Thanks a lot for inviting me.
Of course. And I'd love to start just by talking about how life with amyloidosis is brighter than ever.
Yeah, I totally agree that amyloidosis is no longer a death sentence or sort of a near death sentence. There's definitely a lot of hope, and that's a wonderful, wonderful word when you're dealing with a disease like that. That really does sound frightening, certainly. When I first diagnosed as likely having amyloidosis. Of course, my wife and I, like everyone else would, immediately went to Google and Googled amyloidosis. And especially at that point, this is several years uh, back, it's not pretty. You look up from the computer saying, I may just have a year or two to live or something like that. That's frightening.
Yeah, this is just about the exact same experience that I had back in 2017. And I too went to Dr. Google and was told, you have months to 18 months to live, and it's devastating. But unfortunately, that's the nature of the internet and Google. There's outdated and incorrect information that remains accessible on the internet for a very long time, and this can really confuse patients who aren't yet able to distinguish, right, the old state of amyloidosis versus like the new state where we are now of today's amyloidosis. But I'm sure the news that you read was really upsetting.
Well, yeah, of course it is. Because you go from a situation where you may have been experiencing some issues, but then all of a sudden you're reading online that you may have a year to live or something like that. So, of course, you're frightened. Um, some things immediately gave me a ray of hope. My doctor, I first of all, I was very fortunate to live within minutes of of a center of excellence for amyloidosis. So that was very, very helpful. My doctors wanted to start treatment immediately, so it gave me a sense that I was actually doing something. Um, but also, for me, another real ray of hope. I think I got the standard Cyborg D chemo combination that was at that point kind of standard for treatment for cardiac amyloidosis, AL amyloidosis. But also, I was, again, because I was in the hands of a really good doctor who was in the national community, really searching, doing a lot of this groundbreaking work, searching for treatments for amyloidosis. She was starting a study at OHSU. So I was enabled to enroll in a clinical trial. In fact, I was patient number one at OHSU, where daratumumab was added to the standard Cyborg cocktail for amyloidosis. Um, so I had really good care early on, started aggressive treatment, and participated in a study right off the bat. So that made me feel much more like I was sort of actively taking on this medical fight. Uh, and it gave me a lot of hope uh, to start this journey back to health.
Yeah, I very much appreciate your comment about being under expert care and really seeking that out. Right. I echo that experience, within hours of my diagnosis. My aunt, who works in oncology, got it, got on the ball, and I had an appointment 2 weeks later at the Mayo Clinic, another center of excellence for amyloidosis. And there's great comfort in that, and knowing that the people who are caring for you are really at the front lines of this disease and up to date with all of the opportunities. Like you mentioned, the clinical trial with adding daratumumab to the cyborg D, those kind of things that really advance our knowledge of amyloidosis is so important. And I also agree with you that at this stage, that being kind of the newly diagnosed, you're just starting to learn about the prognosis and the treatment options that are available to patients, is probably the most terrifying time. And it's really the fear of the unknown, the fear of being alone that I think really stands out as a patient.
Yeah, that's interesting. Had you even really heard of amyloidosis before you were diagnosed?
Never heard of it.
And so, that of course contributes to that fear of the unknown and being alone. um, in a sense, you kind of don't know where to turn, who to lean on, and that can really be terrifying. You just feel alone in this very frightening experience. For me, to feeling like I was in good medical hands and starting aggressive treatment very soon, even before that, actually, I found the amyloidosis support group, found a reference to that online as well. So Dr. Google can actually do some good things as well. The amyloidosis support groups run by fabulous people. And I was also really fortunate that there was a meeting about to take place in Portland. And I went to meet that meeting, and that was a huge ray of hope for me. It allowed me to connect with other amyloidosis patients, hear their stories, hear what others had gone through. I saw a number of people who were successfully undergoing treatment and had done well. And that, of course, was a huge ray of hope. A lot of people gave me a sense of what might lie ahead in this journey. So seeing that knowledge looking forward was really powerful as well. The amyloidosis support group also has a lot of medical information and can provide lots of sources for information, including reliable, much more reliable and up-to-date sources on the web. And so just that wealth of information was really helpful as well. But perhaps most importantly, just knowing that I wasn't alone. Suddenly, I was with this group of people who had gone through similar experiences, who could give me their wisdom, give me encouragement, and I just knew that I wasn't alone in this fight. And that really helped give me strength and knowledge and empowerment that I needed to go forward. And it also really underlined for me the importance of educating myself,
Mm.
so I could be that engaged self advocate. I don't know, Mackenzie, did you, make efforts to educate yourself as well?
Absolutely. And you make a really important point about amyloidosis support groups and having that community and knowing that there are other people out there facing the same situation you are that are willing to share and support one another and encourage others. It really gives you as a patient energy to be an active participant, like you mentioned, in your disease. And I too found great comfort in the amyloidosis community and really used that as an opportunity to figure out how to educate myself about amyloidosis because, like we talked about earlier, Dr. Google can be hit or miss. And there are some great resources out there, but it's important to think about where and how you educate yourself. What resources are you using? And so I very quickly found, in addition to Miro's group, the Amyloidosis Research Consortium and the Amyloidosis Foundation. And a lot of the information I learned about the disease also came from healthcare institutions who are centers of excellence. Um, there's a lot of great information that all of those sites have, and I really used those to strengthen my understanding about amyloidosis and, like you said, use that to educate yourself and become kind of an engaged and a more powerful self advocate. But you also talk about being in a clinical trial. And I want to circle back to this. I am a really passionate believer in the importance of research and clinical trials, right? That's the only way that we learn and develop new therapies to treat this disease. And today we're very fortunate. We do have a handful of FDA-approved drugs, which is a tremendous accomplishment in such a short amount of time. But what I'm really truly hopeful for is the pipeline of clinical trials that are going on now, right? They range from focusing on AL to ATTR amyloidosis. They're doing research on cutting edge non-invasive diagnostic imaging or developing drugs to remove the amyloid fibrils that have deposited in your organs, right? What are called depleter drugs and everything in between. It's just truly incredible the landscape of amyloidosis and how it's evolved over the last 5 to 10 years. It's astounding. And research and publications also seem to be gaining a lot of ground and adding to our body of knowledge and really accelerating the dissemination of what's being discovered about amyloidosis.
Sure. I mean, there are really some amazing researchers focusing on amyloidosis today. I've had, the opportunity to be involved with some of them, and seeing the professionals running these studies, the doctors and medical experts running these studies, was really impressive to me, and that did give me a lot of hope. And you can sort of see that in the sort of amazing pace of important breakthroughs that's going on today. You know, that's obviously fabulous news, but I think it also underlines the importance of patients doing their own research as well, or at least who are following, these many medical developments in amyloidosis. And that can help you be able to ask your doctor the most relevant questions about your treatment, learn about studies or new drugs that can be beneficial in your case as well. So, finding ways to try to follow and stay on top of some of this knowledge is really important. Getting on relevant listservs, email lists, attending meetings of the amyloidosis support group, and sort of doing your own informed poking around on the web, all while being armed with the knowledge, with more knowledge, to better analyze the information that you find.
Absolutely, that's a great point that you make. And another area that I think also gives us great hope, like you touched on, is the dramatic education that's going on in the healthcare community. For example, we heard from Dr. Ron Metellus, who's a cardiologist and the co-director of the amyloid program at Stanford, and he said that in cardiology, particularly the topic of cardiac amyloidosis, whether in the form of AL or TTR, is really the hottest topic across the country right now. And he was mentioning at conferences, it's now a mainstream agenda item. It's standing room only. So we know firsthand that within our amyloidosis speakers bureau, right, one of our targets is the residency programs, and that seems to be the fastest growing area that we have. More and more of our residency programs are inviting us to present, and in the audience, we find that there are also fellows and attending physicians who are also participating. And the crowd just far surpasses the residency program. So whether from educating future physicians in medical schools or current practicing clinicians in residency programs, the race seems to be on for amyloidosis in a very big way.
Of amyloidosis is certainly increasing, and thanks in no part to in no small part to organizations like Mackenzie's Mission, which really give a wide array of doctors and future doctors and healthcare workers um, the knowledge to recognize and then ultimately treat amyloidosis. So it's certainly a privilege for me to be part of that organization, of your organization. But I think, looking across the country, there's a growing number of centers of excellence. It's not just Mayo and Boston anymore. I was sort of relatively out in the boondocks in Portland, Oregon, but Oregon Health Science University is a center of excellence, and as I said, was one of the key institutions behind a very important study in bringing in bringing daratumumab online as an important first level of treatment for amyloidosis. A lot easier for patients to have access to good health care in a lot more places on the West Coast, OHSU, Stanford, for example, and more. That can really improve timelines for diagnosis. That's really critical since early detection is so important before damage to amyloidosis goes too far and can reduce patients' need to travel, and that can be a real barrier for a lot of people. This really means huge progress for patients, which is fantastic.
Absolutely. I'm glad you mentioned this because you make a great point in that it's not just about the clinical trials and the drugs, but also the access to those kind of things. And so seeing the progression of our centers of excellence, like you said, it used to be Mayo and BU. And over the years, we've gotten so many credible centers of excellence come online, right? OHSU, Stanford, Columbia, you name it. There's so much greater access for patients to be able to seek care at one of these institutions. So, like you said, that is huge progress for patients. And honestly, I suspect we could keep talking for hours, but perhaps you could offer some closing thoughts that you'd like our patients who are listening to take away.
I began my amyloidosis journey as we've talked about with a lot of fear and foreboding about the future. Um, I'm very fortunate, in part, not in part, really, in progress we've made in diagnosing and treating amyloidosis. Very fortunate to be in a place in life where the disease really doesn't curtail what I do. I work full time. I travel, and in fact, now I've sort of combined my traveling and working by being able to work remotely, even abroad. Um, I ride my bike a lot. I do outrigger canoe races with my wife on our two-person outrigger canoe. I do long hikes with my family. And so I feel very fortunate to be able to continue to do those things that I love in life. And especially this past summer, which was almost 7 years after my diagnosis, the aisle at her wedding, which sort of makes me emotional just to say it. But, it was a wonderful event. And I feel very fortunate that because of all this hope and progress in treating amyloidosis, I was able to be there and be part of that event. So amyloidosis doesn't really affect me physically a lot these days, but of course, I still think a lot about what I've been through and recognize this gift of time, essentially, that modern medicine has given me, and all the progress and the research and the treatment in amyloidosis has given me. And so, it kind of helps me remember the importance of living for today. And I try not to put off things that I want to do someday, I try to do them. But also, of course, I feel a lot of gratitude for the professionals and caregivers that enabled me to get to this point. And I also feel thankful for people like you who are, took your experience and are, you're turning it into something good to educate both professionals as well as patients about this disease and really the hope that we can now experience with it.
Yeah, I'm so glad to hear that you're kind of back living life and doing all of the things that bring you joy, and like you said, not putting anything off that you can experience now. So I'm so glad that you're at a point where you're able to live your life to the fullest and make the most of it every day. So I'm so glad that you shared that with our audience. I think it's nice to have hope for them, right? But most importantly, thank you so much, Dan, for joining us today. It's been an absolute pleasure to have you on our podcast, and I'm very grateful for you taking the time to speak with us today, and also all the work you do at the Amyloidosis Speakers Bureau. So thanks so much.
Pleasure to talk to you.
Of course, and for our listeners, I just want to add a few parting comments of my own. You know, Dan makes some really great points, and in addition to those, I want to offer a number of things. First, we talk about this over and over again, but the time to diagnosis remains such a critical part of a patient's journey. And a good number of patients, even today, are still being diagnosed too late. So, for patients out there, please don't wait. Advocate for yourself. And it's important to remember that after all, it's your life and waiting affects you. So, don't wait. Two, there is still value, and it does matter that you're under the care of an amyloidosis expert or someone who's at least familiar with the disease, right? You want to make sure that they're a part of your care team, whether that be directly or supporting a more local team that you have. Three, if you're given an opportunity to participate in a clinical trial, please at least consider it. Try to learn more about the trial, what they're doing, because that's how we get early access to new treatments, often at no cost to the patient. But it really helps advance the treatment options for patients that will come after us. And that is so important. Next, the speed at which advancements are happening in the world of amyloidosis is astounding. And there really is so much hope out there. And so I wanna highlight that. Fifth, amyloidosis, it seems to be that it's on a path to becoming a manageable chronic disease for all types of amyloidosis. So that might not be too far in the near distant future. And, maybe even one day we'll get a cure for this disease. And then lastly, most importantly, keep fighting, right? There's so much to be hopeful for. And don't ever give up. Thank you for listening to the All Things Amyloid podcast. If you find our podcast informative, please follow and share it with others. If you want to learn more about the work we're doing at Mackenzie's Mission, please visit mm713.org. We'd also like to thank AstraZeneca Pharmaceuticals, Alexion Pharmaceuticals, Alnylam Pharmaceuticals, and Bridge Biopharma for their sponsorship to help raise awareness about amyloidosis. We hope you stay tuned for future episode drops. Thanks for listening.